So I want to get started with the first talk, which I described already as sort of this idea of the empathy machine. And I want to start with this picture. It's a picture I've shown before in other talks I've given. But this time what I want to highlight is this idea that I'm with this patient who's allowed us to show her image. She's one of over 3,000 patients at Cedars-Sinai who have used virtual reality for a number of different conditions. And at this particular moment, what's noticeable is that we're both looking at each other. Now we're looking at that technology, but that's interposed between us. And what I want to emphasize in this talk is that unlike some other technologies that avert my gaze as a doctor, this is a technology that is actually quite different. I mean, we're in this era of big data analytics and artificial intelligence and algorithmic diagnostics. And during this time, many doctors sort of complain that technology really disrupts the physician-patient relationship and it can undermine the art of empathic medicine. But in fact, we know that right now, especially, doctors spend more time conducting desktop medicine, where they're staring at computer screens, than bedside medicine, where they're looking patients in the eyes. But what I want to do in this talk is reveal how VR can flip desktop medicine on its head. In contrast to other technologies that require docs to stare at screens in lieu of facing their patients, VR reminds doctors to focus on their patients and to consider their inner lives. It prompts doctors to consider the subjective nature of illness, and it can enable patient-centered dialogue and shared decision-making. That's what I want to focus on today. This is a picture of my own clinic where I normally am seeing patients. It's been rather empty, just started getting back into it recently. And what I want to point out here is if you look at the way this is set up, there's a computer screen right there physically interposed between the doctor and the patient. It's a system that was really designed to support the transactional needs of billers and administrators, not to support the biopsychosocial needs between patients and their providers. And as a result, it kind of physically and even emotionally separates me a bit from my patient because I spend a lot of time looking at that screen and typing into that screen. And now we've known for some time that these screens, have a great deal of information. But if you look at the screen and you see all the different types of data that we're presented with, you can sort of start to wonder if our patients are becoming alphanumeric strings, if we're starting to think about our patients in terms of codes and numbers, and not really seeing the patient within all of that jumble of zeros and ones, almost like it's a tidal wave that's overcoming physicians. And this was a problem well before pandemic. But now what we have is the added issue of not even being in the same room with many of our patients for this time and having to stare through that computer screen while we're surrounded by zeros and ones. Now, long before the pandemic, Atul Gawande wrote this article, Why Doctors Hate Their Computers. And what's really interesting about this, if you look at the right, is this sort of graphic of a doctor being separated from her patient with layers and layers and layers of data. And that's at a time when we were still at least physically together. Now we're no longer physically together. So what does that mean for how we can use something like virtual reality to help, in a way, learn more about our patients and bring back the empathy and the humanity? Not that it's gone anywhere. It's not like there's a huge crisis in medicine, but there's still an opportunity to strengthen that shared decision-making with patients. So Eric Topol down in San Diego Scripps has said in his writing that what's wrong with healthcare today is that it's missing the care. And, this is sort of an ongoing concern that, particularly, and this is in a book where he wrote about artificial intelligence and health technology, which, as I said, can distance doctors from their patients and undermine the human touch. Now, the idea is that virtual immersion, though, can motivate doctors to confront the biopsychosocial illness of their patients. It can prompt discussions that might not otherwise happen in the absence of vivid perspective taking. And that's a term I want to come back to throughout this morning, is this idea of perspective taking, where, for example, young doctors in training can practice interviewing virtual patients in low-risk environments or learn how to empathize meaningfully and reproducibly, and maybe even cultivate enhanced emotional and social awareness about their patients' life experiences so that we can undo this concern that Eric Topol is talking about here. So when I stare at that computer screen, I see things like this. My patients become mapped into these ICD-10 codes, these alphanumeric numbers, right, and alphanumeric strings that really don't tell me anything about the human underneath those numbers. And think about this one here in the middle, Z91.410. This is an alphanumeric that dispassionately maps to a very serious condition: adult physical abuse, domestic. That's how it's mapped. And this might flash across my screen, and I may not really recognize, what does that mean? I have personally not been physically abused, but many of my patients have. And I see a screen like this, and I don't necessarily have the ability to understand what that means. And it becomes even less capable when I'm talking through a computer screen and seeing these kinds of digits in front of me. So this all changed when I went to the University of Barcelona, and I visited this lab of Mel Slater and Mavi Sanchez Villas, and found out what it's like to actually be in a domestic violence scenario, which she was able to create for me. And she put me in a virtual reality headset, and I looked at a mirror and I saw myself as a woman. And as I put my arms out, this woman's arms went out, and very quickly I realized that I had embodied a female figure, and it was extremely convincing technologically. But what happened next was remarkable, because as I looked over to my right, this man came into my room. And I have a video of what happened next, and hopefully you can hear it, and I've put some subtitles in case you can't, so that you can see what happened next, and this is a video of the experience.
Have you seen yourself in the mirror? I mean, where do you think you're going looking like that, huh? Just shut up. You could put some effort in and dress up or something. Look at me. Jeez, you look 20 years older than you actually are. Do you know, there's not one woman out there who looks as wretched as you do right now. I said, shut up, you fat cow. You're disgusting. Aren't you going to say anything? I said, look at me. Yeah, of course. No. Typical you. This is all my fault. It's been soft on you. Yeah. Been too patient. You know why? Because I love you.
When I took off the headset after this experience, I was just silent. I think I was shaking, literally. My brain was rattled by this experience. I embodied that experience, and I felt like he was literally looking down at me. As tall as I might be, he was always going to be taller. He was staring at me, he was abusing me, and I felt it. I can't pretend at all to know what it's like to have the pain of a victim, but at least I had embodied the role in a simulation. And what's amazing is Sanchez Vives and colleagues have done a study now where offenders, domestic violence offenders, have become the victim in virtual reality. They worked with the Catalonian authorities to, as part of a rehabilitation program, offer this to offenders. And what they did in this study is expose patients to different emotional stimuli and ask people to recognize what emotion is shown in this face and in the body, whether it's congruent or incongruent. And what they were able to demonstrate was that these offenders, before versus after going through this experience, were better at quickly recognizing fear on the face of a woman. And they had a control group where they didn't show that difference. So it was actually the offenders who showed that inability initially to recognize emotions, and then develop the ability to do so after going through this experience. So what is this all teaching us? It teaches us that VR is a tool for perspective taking, and perspective taking is the key to empathizing. We empathize with people when we see the world through their eyes, and we acknowledge their experiences. Sharing the first-person perspective of another person in distress can cultivate compassion. That's how I felt after experiencing that simulator. Like I said, thankfully, I've never been beaten. I've never been abused, thank goodness. I've never been told to dress differently because I look ugly, or been knowingly regarded as an inanimate object. But the VR simulator, it caused me to mentally rehearse those experiences. So now when I see that ICD-10 code for domestic violence flash across the computer screen, or when I learn that one of my patients has been abused, I think back to that time in that laboratory in Barcelona. And I have this mental anchor that causes me to stop and to regard what it means to be a victim of domestic violence. It causes me to think differently because I've now seen this perpetrator come at me with my own eyes. I've heard the abuser yell at me with my own ears. And as I said, I'll never know that pain, but I've at least embodied it. And that's the first step towards perspective taking. So when I see that code down below, it's no longer a simple alphanumeric. And there's really no other technology that can do this. I can't read a brochure or watch a video and experience what I experienced. And Chris Milk emphasizes that VR connects humans to other humans in a profound way that I've never seen before in any other form of media. It can change people's perception of each other. That's how I think VR has the potential to actually change the world. That's a profound statement from Chris Milk. Now, we're learning more and more that we can potentially enhance empathy with virtual reality. And there are other VR researchers around the world leveraging this power of perspective taking. For example, as we'll hear later, studies reveal that when light-skinned people experience living in a dark-skinned body, it can reduce implicit bias against racial and ethnic minorities. Other research shows that virtual embodiment can boost empathy for people who are homeless, or for maltreated children, or for Syrian refugees, for the elderly. So this effect of VR, it's so extensible that it can even cause embodiment of non-human forms. In one study in the bottom right, led by Jeremy Bailenson at Stanford, they used VR to make people feel like a cow being prodded and poked and being shipped to the slaughterhouse. So if VR can shift perspective so radically that it can cause people to empathize with cows, then maybe it can also instill more humanity into healing. As I said before, as a doctor, I always try my best to empathize with my patients, but it's not always straightforward because it's difficult for me to really truly know what my patients are experiencing. I don't know what it's like to be blind, or to have advanced dementia, or to have schizophrenia. So this is where VR can make a difference. Like I said, I felt differently about that domestic violence experience ever since going through it. So, this is a picture from MM&M and online where they show a picture of somebody coming out of virtual reality, one of these simulations, and you can just see what he's thinking. You can see what he's going through with his hands cupped on his mouth. Take another example, G30.9. So G30.9, that's Alzheimer's disease, unspecified. Once again, what is it like to have Alzheimer's disease? What is it like for the family who's struggling to take care of a loved one who has Alzheimer's disease? Carrie Shaw, who at a young age started to recognize that her mother was developing cognitive decline herself at a rather young age. And she dedicated her life to just developing a system where other people can experience what it's like in honor of her mother. And she developed, in this case, a VR experience of being in the shoes of somebody with cognitive decline. And here is an example. It's a video that was developed from the Alzheimer's Foundation of America, where in virtual reality, you can look through the eyes of a man, and this man, his name is Harry, and he's 76 years old, and he is a former veterinarian, very high-functioning doctor. But at this moment, he has awoken at 2 o'clock in the afternoon. He can't tell what time of day it is. The arms on the watch are spinning around. He confuses his medication. He confuses his toothpaste for muscle relaxant cream. And you experience his life literally through his eyes. And it's truly a powerful experience. And we're learning now when medical schools use these kinds of systems, like this study out of Massachusetts, they determined that students can demonstrate increased understanding of and empathy with older adults who have age-related conditions like macular degeneration and hearing loss. So I want to show just a couple more examples. How about J06.9? This is an upper respiratory tract infection. And here there's a real important opportunity for empathy, because what happens often is patients will come to the doctor with a URI and they feel like they need antibiotics. And then the doctor sometimes unempathetically says, you don't need those, just go home and you're going to get better. Well, maybe we can use virtual reality to improve that discussion. This is an example out of the United Kingdom where they did just that. They created an environment where young doctors could practice over and over again working with what they called unreasonable patients. I don't know if that's the best term for it, but they created these environments, and I want to quickly show you a video. And the sound isn't ideal, but you can watch some of it through the subtitles at the bottom of what's happening as this family is demanding antibiotics and how this young doctor is practicing and really struggling trying to get the right words.
So unfair. It's going to ruin our holiday. I'm going to take this up with the local health authorities. I think you are unfairly denying medicine to my mother.
I appreciate your concern. Thank you for your feedback. I do think that the best medical practice at the moment is to manage this conservatively for now.
My mother worked and paid national health insurance all her life. Now look at what's happening.
Sure. I mean, this has got in no way to do with your mother's health insurance payments. I believe.
So it goes on, and you can see how he's going to sort of struggle back and forth, but with practice and practice, they find that this system does allow doctors to become more empathic in their communication style with their patients. Now, I want to switch gears for the last part of my talk. I've been talking about how doctors can become more empathic with their patients, but there's another opportunity here, and it's for patients to become more empathic with themselves. And I want to give a couple examples where we've done a study and others where we've worked on patients helping patients with one another. And this is an incredible study from Carolyn Falconer and Chris Bruin out of the United Kingdom, embodying self-compassion within virtual reality and its effects on patients with depression. And in this study, what they did is they took patients who have depression and they put them in a virtual reality environment where they sat in a room across from a young child who was distressed and crying. And the requirement was to try and calm that child and work with that child to make her feel better and less distressed. And after going through that in virtual reality, the patients switched bodies and they became the child and looked back up at themselves, showing compassion to themselves. And it's really sort of a mind-bending experience, but what ends up happening is people realize how much compassion they have within themselves and the ability to show that to themselves. And in this study, they demonstrated improvements in depression scores, not just immediately, but durably over a period of time, suggesting that this could be another approach to helping to manage depression. Here's another example where we work directly, in this case, with parishioners at the Holman United Methodist Church in the Adams District in Los Angeles. And we worked with the pastor, Calvin Sauls, and Bernice Coleman, a researcher at Cedars-Sinai, to see if we can reduce high blood pressure in this group of parishioners. And the idea was, can we find a way to help people better understand, just not only understand what's happening in their body, but to empathize with what's happening in their body so that they can change a health behavior, in this case, reducing salt intake in the diet. And so this was an intervention that we developed from the ground up with the parishioners and with Pastor Sauls. And we ended up creating this kitchen where you can go in, and we worked with dietitians and with the parishioners to identify plates of food that were culturally appropriate. And underneath each of these lids, you can see the food and find out how much salt is in it. And as people started to discover how much salt was in their food, they would start to fly through their body, in their heart, their blood vessels, their brain, their kidney, and a voiceover would start discussing what's happening as the salt damages the body. And then they would come back out of that, and Pastor Sauls would come out and give a sermon in virtual reality and essentially pray on this and sort of make a decision. Are you going to do what's right for your body and your mind and your spirit and your soul or not? And after this, we found a 7-point drop in systolic blood pressure, which was remarkable in this still unpublished study. Now, Pastor Sauls spoke about this in one of our VMed events, and I like this quote. He says, "I love technology. Don't get me wrong, I'm all about high tech, but that has to be accompanied by the personal touch, by the holy touch. It's not just about putting a screen in front of people. It's about inviting people into catalytic spaces so they can participate in meaningful engagement." And that's what VR can do, is this idea of meaningful engagement. It's a powerful concept. One more example of patients helping themselves. This is a very profound study from Omer Liran at UCLA, where he used virtual reality in patients who had low compliance with their antiretroviral medications for HIV. And he wanted to inspire them to understand what's happening in their body. So he created a set of virtual reality experiences where you can go into your body and see as the HIV inserts itself within immune cells. And as this is going, there's rather ominous music playing, there's a voiceover, but later on, the patients use a hand controller, and as they click it, they can deploy medication to put a shield around those immune cells and block the HIV from entering it. And there's uplifting music and a very positive, emotionally supportive theme music. And what he ended up finding was that, incredibly, those who when they were randomized to this experience, they saw a reduction in the viral load. In the actual clinical outcome, the viral load was reduced in people after experiencing this VR intervention. And so Liran concluded that compared to other traditional media platforms like videos, VR is more immersive, has a greater positive emotional impact. And that this would not have just happened if we had, he had handed out a trifold brochure or watched some kind of 2D video. It allowed patients to see themselves differently, understand themselves differently, and gain a healthy new perspective that endured long after removing the headsets. So, these moments where people have this insight and they have this sort of sense of awe and amazement, this is the moment where worldviews can change, and it's really remarkable. And the question is, what's happening in these moments? What's happening in these moments when people are experiencing empathy in virtual reality? Is this VR-induced awe and empathy like some kind of ineffable feeling, or is it actually something we can directly observe and measure and harness? If we could do that, if we could observe it, then maybe we can create software that is tailor-built to custom support compassion. And this is an evolving field of science. It's called empathic neurofeedback. And there's all sorts of fancy ways to measure empathy, but one simple way is just to look at somebody and see if they literally have goosebumps. That's a very simple, easily observable sign of empathy. It doesn't require any fancy equipment. When goosebumps occur from an emotional experience rather than just, from feeling cold, that's called psychogenic shivering. And some people have more shivering than others. You've probably felt it at some point in your life. It could accompany a perception of awe. Astronauts, when they're up in space and look down on the Earth, will often say that they have this sense of awe and goosebumps and chills. It can accompany a sense of altruism, a feeling of openness or profound meaning. And so, it occurs during these transformative experiences like weddings and religious or spiritual events. So can VR literally induce goosebumps? Well, this is an incredible study from Simon Fraser University, Are You Awed Yet? How Virtual Reality Gives Us Awe and Goosebumps. And they posited that VR can help make self-transcendent and potentially transformative experiences by exposing people to these beautiful terrains. And then what they did is they actually measured their goosebumps with a goose cam. And they were able to find, incredibly, that people got the willies. I mean, I think they found that around 40 to 45% of people within minutes had goosebumps, more in women than in men, interestingly. But also, the goosebumps correlated with this subjective experience of awe and wonder and curiosity, and even humility, which are all some of the factors that we're sort of looking for when we empathize. So this is more than a headset. I'm going to wrap up here. This is more than a gaming platform. When we use this virtual reality, we're thinking more about just gaming and entertainment. There's all sorts of opportunities we're going to talk about for the rest of this session, where we can transform people to fantastical places, provide opportunities for empathy and awe and pain management, as we'll learn about. Medical VR is not just a computer science or an engineering science. It's truly a social science and a behavioral science. And everything I've talked about today, there's one chapter in the book on it. This is the VRX book that will be coming out in October. You can check it out on Amazon if you're interested. And this will be a comprehensive review of VR in healthcare. So with that, I'm going to end and move us ahead to the next talk. And I want to thank a lot of people at Cedars-Sinai who have participated in setting up today's event, and also for the research that I've been presenting today and that you'll be hearing throughout the rest of the day, including all of our students and trainees at Cedars, some of whom are on the phone. And thanks for all the folks at Cedars that support our research.